Welcome to the Career Ready Podcast. Learn about resumes, cover letters, LinkedIn, interviewing, and all things newbie career ready with the Career Service Center at College of DuPage. I'm your host, Pierre Michiels, for today's episode. In addition to learning about resources and the job search process, important part of being career ready is understanding career paths. To help us explore the field of ophthalmic technician, I have Mitzi Thomas with me, who works as a department chair and assistant professor here at College of DuPage.
Thanks, Pierre, for having me on today.
Thanks for being here. I'm excited to learn a little bit more about the field and what you're doing to prepare students and developing professionals for the field. But before we get into that, can we just start off with a little introduction, or as we'd like to call it, your elevator pitch?
Yeah, I've been with the college now this is approaching my 9th year as a full-time faculty and chair. And I started off in a similar program to what we run at the college, a 2-year associate's degree program in ophthalmic technician at one of our schools in the area. And I got the privilege of working in a hospital system right after the program and did a lot of clinical ophthalmology. And then worked at a few different hospital systems and just have had the privilege of, working with some of our industry partners in ophthalmology and eye care, and eventually gravitated towards the training and teaching side of things. So that's kind of how I branched out from the clinic, and then had the opportunity to start the Ophthalmic Technician Program actually 9 years ago at COD. So that is how I'm here.
Well, thank you for that. I didn't realize that you were kind of an origin source for the program. So really excited to hear what you have to say and how you've incorporated that professionalism that you noticed through the field and you bring that to the program. So can you just talk a little bit about the ophthalmic technician field and the different career paths that this could lead towards?
Yeah, absolutely. Ophthalmology is the big branch of medicine that ophthalmic technicians primarily work in. So, ophthalmology is where we're focusing on eye care and any specialty that lies in there. So, the ophthalmologist is the doctor that we're working under, our primary MD. And they do routine eye exams and whatnot, but then they also will specialize in surgery. They'll focus on the diseases of the eyes. And so our role as an ophthalmic technician is to support the ophthalmologist and then helping them with any of the testing. So a lot of diagnostic testing we do. We can help in the surgery arena if that's something that we chose to do. We can help with minor procedures, and we do a lot of imaging and a lot of diagnostic testing. So basically our job is to make the ophthalmologist's life a lot easier, but then also our job is to help our patients in helping them restore their vision, keeping up with their eye health. And our programs at COD, we have 2 pathways. So we have the Eye Care Assistant Certificate Program. So everyone comes in as an eye care assistant program candidate. And then that's 3 semesters long, and that's an entry level. If a student would like to also get their associate's degree and then get into the next level of certification, then they would move forward with the ophthalmic technician AAS degree. So those are the 2 tiers that we have right now.
So we have those 2 paths here at COD. So the assistant, that certificate, it's like a year and a half, 3 semesters, right?
3 semesters.
And then the technician, the associate, that's just
5 semesters.
5 semesters total, right? And then can we just compare that? Like, if you want to be the doctor, how much education is that?
Being a doctor is a lot more education. So a doctor would go through regular medical school. So that could be after their undergrad that they might be applying, or maybe it's a straight program. So you would do medicine and then do a residency specifically in ophthalmology. And then after your residency year, you might also want to do a fellowship to specialize in a specific part of the eye. So let's say you want to specialize in the cornea, or if you want to specialize on the retina, that would be an additional training. So ophthalmic technician program is pretty much a fraction of that. But with that being said, our doctors are very, very bright, very smart, very educated. And so they are looking for people to work with them that are kind of at that same level, right? That really care about those critical skills, and just looking into, those really being detail oriented, because we are dealing with the eyes and a lot of the measurements that we take are very specific. And especially if it's related to surgery and maybe a person needing to have a specific type of surgery to correct their vision, we're looking for measurements. And so those are very, it's very pertinent that those measurements are accurate. So a lot of our training is basically focusing on those aspects.
And I just wanted to ask that, right, to really illustrate that if this is an area, a field that you're interested in getting into, you do have options. There are some that will let you actually get in there, start working, earning money a whole lot sooner,
Right.
or you could take years and years and years to study, and then eventually get there, right? So that's why I just wanted to kind of point out that contrast of being able to enter the field versus needing to take many years before you could really start uh, working in the field.
Right. Right. Yeah. And we do get students who come into our programs who start off thinking that maybe they do eventually down the line want to do medical school, or even optometry school. I know we haven't discussed that yet, but they think that maybe they would want to do that. But they also just want to know what the field is about before committing to a long-term optometry or medical program. So it's a nice way to get your feet in the door and just really understanding if this is something that you wanted to invest in many years. And I'll be honest, most of our students decide then that they would like to stay being an ophthalmic technician, because they do get a great job once they graduate, and they're thinking, well, why do I need to have that responsibility? And then also that added education and tuition is not cheap, right? So so that ends up being a factor too, as students are kind of weighing on their options.
So it sounds like if someone were to opt into this path, starting off as a technician and working as a technician as you continue on in med school and everything is an option. It gets you started in the field, but a lot of times, if this is something you're really interested in, you realize that the technician role is a really satisfying spot to be working at.
Correct.
So, as we think of the field, what skills or strengths do you see students needing to succeed, not just in the program, but then as they do enter the field?
There. So, first of all, just like an I can attitude. A lot of times, this is your first into the medical world, right? So, our students start our programs and go into clinicals right away, actually, like the first semester, very quickly, a few weeks into the program. So, it can be a little bit of overwhelming, right, in the beginning to see an atmosphere that you're not familiar with. So, I like to say have a can-do type of attitude just to kind of take everything in that you're seeing, because you're there to learn. And even though, the first few weeks might be a little difficult just because you've never seen it before, you've never experienced it, it gets better. So that's, and just in general about our programs, and then also kind of going into the workforce, because every place that you're going to go into is different, right? The way that they function might be a little bit different. Their expectations might be a little bit different. So it's just nice to have a kind of an open mind there. Also, communication is very big in the medical world. So you're not only just communicating with your peers, your coworkers, but you're also communicating with patients. So These things might seem obvious, but just kind of speaking up, right? Having a loud voice when you're talking. We do have quite a bit of senior patients, and so, a lot of people might be hard of hearing. And so you just want to make sure that you're clear when you're talking with patients, because as an ophthalmic technician, you're the person that is spending more time in that room than the doctor, because you're the person that's gathering all the history and the information. And then I mentioned detail oriented, kind of being clear with your documentation. That's super important. So double checking your work. If you're not sure if something is accurate, you want to double check it. You want to grab somebody in there to make sure that the work that you're documenting is correct. And then critical skills are very important, critical thinking skills. So, there's been many times I remember being in the field where a doctor will ask me a question to see how I'm thinking, but then also probably to think like, hey, am I thinking the right way? So it's nice to have that kind of a relationship. So they like us to kind of think like them, because then we produce the work that they're looking for, right? So kind of going above and beyond. So if you see something, let's say, for example, hey, the vision is poor, but it's not horrible, but you've noticed a decrease from the last time the patient was here, right? A technician that would be using some of their critical thinking skills would think, well, I need to find out why that patient's vision has decreased, right? Versus just letting it go because it's acceptable as far as, well, it's not a big change, but it's also a change, right? So just kind of looking more than just kind of the obvious, and understanding why behind what you're doing is important as well.
Well, it's good to hear about those skills. And it gets me curious, as they're a student and then developing these skills to enter the field, are there different experiences or opportunities that you recommend they seek out to prepare them for the field and start, developing and enhancing these skill sets?
Do you mean before they come into the program or while they're in the program?
Probably more so while they're in the program, but
Yeah.
if you have thoughts on both.
Yeah. Um, so a lot of times, I, they're getting such great experience already because they are going into these externship and clinical opportunities. So the, what's expected is expressed right away. Students have competencies that they have to meet, not only for in the clinical atmosphere, but then also in our lab environment. And so we test them on certain things because they have to be able to perform to be able to do the next course. So as far as preparation is studying the material that's given. A lot of times, you might see it the first time and then you're expected to start practicing it immediately. And so a lot of it is like going beyond what you're doing in the classroom and also continuing to practice as you're going through each skill, just to make sure that you're doing it accurately. And if you have any questions and clarifications that you need, you want to make sure that you're reaching out to your instructors, you're reaching out to your clinical mentors, and the doctors that are in the clinical sites, just to make sure that you're on the right track.
And so you just mentioned some of these things, but if you could maybe expand on them, and maybe there's more to it as well, but along with those labs, those externships, those different clinicals, what are you doing in the program here at College of DuPage to prepare students for the field?
Yeah. So we are an accredited ophthalmic technician program. So it's pretty strict as far as what the standards are on what we're supposed to do. So in a way, it's nice because that our program is regulated by having to show that our students have completed, A through Z. So each semester we have a list of skills that they have to basically demonstrate that they are competency in it. And so what we do as far as preparing them is we spend our class schedule is where we're meeting once a week in person. And so we spend lecture and lab hours basically going through the concepts in a didactic format, but then we're also giving them a hands-on as well. And then they'll take that hands-on and then apply that when they go into the clinical atmosphere. Now, sometimes because our students are starting clinicals right away, they might not have even had a chance to practice it in the classroom setting, but they might be seeing it for the first in an actual patient setting. So sometimes that could be like, oh, wow, very exciting. Other times they might be a little bit of overwhelmed. It's like, oh my goodness, we haven't learned about this yet. What is this? But then when they actually do have to get competency or, they do need to be tested out of it, they feel more comfortable because it wasn't like they were being exposed to that, only once. They had been seeing that kind of repeatedly. And then they're officially being asked to show how they're doing in that skill. They feel comfortable. We also do a lot of simulations with our students. So we have a lot of nice technology that helps us to be able to demonstrate that. We have an electronic health record, which is something that is used in patient care. And so we have a version of that, a student learning version of that. So that gives them kind of the real life experience on what it's going to feel like when they're in clinic and in that environment.
It sounds like you, through the program, are providing a lot of great hands-on experiences, right? They're not just developing this knowledge base, but they're really getting to apply what they're learning and hopefully feeling comfortable and confident that you could enter the field and kind of hit the ground running.
I don't want them to just get my version of it, right? I want them to get a few different versions of it. So I have an optometrist who is a doctor in optometry who helps teach our programs. I have other certified technicians, actually some that are even from out of state. They're not only in Illinois. So it's just really great because they get a really diverse perspective of, the experiences that our instructors have. And so they're sharing those experiences with our students.
All right. Well, thank you for the information. As we kind of start winding down here, is there anything else you would recommend to students or young professionals to prepare for the field?
So, what I would recommend is, a lot of times when you're looking at a medical program, there are a lot of programs that you're interested in or maybe, only have knowledge about. And so just kind of being a little open-minded to other programs that are out there. There are a lot of smaller programs out there, as ours is mentioned, ophthalmic technician and eye care. And, even if one program, let's say, I don't want to put a specific example there, but let's say another program that you tried to get into in health sciences was difficult, right? You just it wasn't what you expected, and you're not meeting the goals that you have to do with that program. Don't give up, because there are many other programs in health sciences. And so it might just be as simple as you finding the one that fits your needs. I can't tell you how many times we get students in our programs that plan A and plan B didn't work out. And they never even had heard about the eye care program, right? So just kind of having that open mind to be like, wait, there's a lot of similarities with this field than that other field that I was thinking about. So just kind of having an open mind and trying something new, go on an advising session just to see what else is out there. Because you might be surprised. There might be something else that fits what your original interest was in coming into healthcare.
Right. Well, thank you for all this wonderful information. If someone wants to learn more about the programs here at College of DuPage, how can a listener find that information?
So our web page, I'm not sure if we can list that information. We'll have information about our programs. We do also have multiple advising sessions. We do group advising sessions, and then I try to get on as many individual advising sessions as possible to be able to, and it's great because we spend about an hour with each student, just kind of going through all the details of the program just to make sure that it's the right fit for you. And then we always have open house events throughout the year. So just look for that information. And they can always email me if they're just trying to find out more information about the programs, and I'll get you to the right place.
All right. Well, I'll make sure your email and the webpage is here in the show notes. And then I'm guessing the webpage will also have the information about those advising sessions and open house.
Correct. Yep.
Yep.
You
All
got
right.
it.
So our listeners just go find that webpage to get more information. All right. Well, thank you, Mitzi, so much for sharing this great information.
Thanks, Pierre, for the opportunity. Take care.
So with today's episode, there was no listener question. However, if you have a question, you can submit it to careerpodcast@cod.edu or on social media at COD Career Center, and you can hear it answered in a future episode. Thanks to all our listeners, and special thanks to Mitzi Thomas for joining the Career Ready podcast. We hope you have a better understanding of optometry and specifically the ophthalmic technician field.